Okay, we're going to talk about wrapping a fenestrated drape. So a fenestrated drape is a cloth drape that has a hole already cut in it. This hole is going to allow for a sterile area with a small area that the surgeon can access the patient for surgical procedures. The way that this drape is folded and wrapped is very important to maintain sterility in our operating room. So the supplies that you're going to need, of course, your drape. You're going to need a sterilization indicator, masking tape, autoclave tape, and a Sharpie, as well as your packed material. So in this case, we're going to use 2 cloth wraps, but remember that you can also use Denison as well, or a paper product. Okay, so to fold this, we're going to fold this fenestrated drape the same way that we have folded everything else, which is in an accordion style. So lay it out flat on the table in front of you, fold it over on itself in half, and then fold it back on itself, and back on itself again. Okay, this is now going to give you the size that you want, and you will begin to use that size to accordion fold your drape. So basically, we have created a drape that has been accordioned 8 times. And try and keep it nice and neat and even while you're folding this. And then we're going to do the exact same thing that we did with the surgical towel. So we'll fold it up in half, back in half again. And then with this one, you can go one more time. Again, that now gives you the size that you want. So you will accordion fold it from there. It does not have to be made this small depending on your surgeon's preference. It could be a little bit flatter, so you could do a quarter fold on this drape as well. What is important is that it is appropriately accordion folded, so that when the surgeon picks this drape up, what they will do is find the corners of it, and they will just pull those corners out and the drape will drop. So it doesn't matter how small it's folded, it just matters that it has been accordioned appropriately. So I'll show you a quarter fold as well. So with a quarter fold, it's the same as with your surgical towels. Over on itself once, back on itself, back on itself, and then the same way you're going to do 4 folds in each direction. As you can see, this creates a much larger drape, but it is much lower profile, so the steam will have an easier time penetrating it. Whether you fold 8 times or 4 times is really going to be surgeon's preference. Alright, after you have this folded, I'm going to go back and fold it in the 8s. After you have it folded, you're going to proceed with wrapping it the same as you wrapped your gown pack or your instrument pack. It's wrapped exactly the same way, so it will be wrapped 2 times, and it will be labeled exactly the same way. Remember that the label should contain the contents of the pack, the initials of the person who is wrapping it, and the date of sterilization. All right. Okay, so once we have it appropriately folded, we will get our wrap material. Remember, you always start with your wrap material in a diamond or kite shape in front of you on the table. Put your item to be wrapped in the center, add your sterilization indicator strip, and then proceed with wrapping it. So remember that we're keeping tension, keep it nice and tight. Notice that we have a lot of extra drape material here, so we can't just fold this back one time. We're going to have to accordion our edges, but remember that the corner of your drape has to be pointing in the direction that you should pull to open the pack appropriately. On the sides, gather up all of your material, make it nice and tight, and again, make sure that the corner is facing in the direction it should be pulled. Repeat on the other side, and then close your pack by making a nice pointed triangular flap and pulling that over on itself, tucking it underneath the previous fold. So that has been wrapped 1 time. We wrap everything for surgery twice. So we're going to take another drape, put it in the diamond pattern, and proceed to wrap it again in the exact same fashion. once you have your pack wrapped twice, you will close it with your masking tape. Remember, we use masking tape because it is less expensive. And remember, we always put a courtesy tab on any of our pack closures. That courtesy tab should be at the top, away from the tab that you will use to open it. And it should be on there snugly. On the masking tape, we will write the contents of the pack. So a medium drape, the initials of the person who wrapped it, and the date of sterilization. And then we also have to remember to put a piece of autoclave tape or indicator tape on here to serve as a visual aid so we can tell whether this pack has been appropriately sterilized.